The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another issue of Inside JACC. And today I'm talking to Dr. Michele Emdin. And Dr. Emdin is the head of the cardiovascular division at the CNR in Pisa. And he is actually an editorialist for a very interesting paper that we have in Press and JACC that comes from the Mayo Clinic Group and Dr. John Burnett and deals with biomarkers and particularly the prohormone of NT-proBNP. So, Michele, tell us a little bit about this study and why you thought it was important.
For the first time from this relevant study, we have the demonstration that the prohormone proBNP is circulating also in healthy people. This is a general population-based study, and they found that the assay of proBNP has a similar diagnostic accuracy for the detection of left ventricular systolic or diastolic dysfunction as compared to the commercial assays for the NT-proBNP or the biological active hormone BNP.
Well, from a mechanistic standpoint, it's rather interesting that this shows the neuroendocrine aspects of congestive heart failure, doesn't it?
I think that it gives us clues for improving our pathophysiological interpretation of the clinical evolution of heart failure, which initiates as a pump failure, but it is going to become a failure of the endocrine heart too. We know about the concept of natriuretic paradox. In the sense, we observe that there are high level of natriuretic peptides in heart failure patients, which theoretically have a natriuretic and vasodilator action, but there is the lack of this biological function in heart failure patient. The observation that a huge amount of inactive prohormone explains the high level of B-type natriuretic peptides is another information explaining this paradox.
Yes, very interesting. And of course, from a practical standpoint, the question comes down, does this new information help us in screening? Because they did have a large population of patients, normal and stage A heart failure with just left ventricular dysfunction, but still probably not quite sensitive and specific enough to do mass screening of otherwise asymptomatic people. What is your thought?
Their findings tell us that actually there is a good, accurate diagnostic power of this prohormone assay, which has to be confirmed by further studies in the addressing also the need for reference ranges and age, gender, and ethnicity founded cut points. But actually, this assay seems specific, and if automated platforms become available, we could think about the possibility of its use for a screening program, which is, I think, a big task. Not only clinical cardiology, but also primary medicine primary care has to face to detect the large population of asymptomatic left ventricular dysfunction subjects.
Yes, and of course with cardiac ultrasound now coming in smaller handheld units, the ability to rapidly screen the heart and look for left ventricular dysfunction will lead us to say how we will balance this. When will we use natriuretic peptides for screening? When will we go directly to looking at left ventricular function? A very interesting concept and important paper. Thanks for being with us. For Inside JACC, I'm Tony DeMaria.